In the small town of Elmwood, where everybody knows everyone, there stands an old brick building painted in a comforting shade of pastel blue. This is the Elmwood Pharmacy, a beacon of hope and health for the local community. Behind its counter, with a warm smile and a ready ear, works Mary Bennett, a pharmacist whose empathy and dedication transcend the traditional roles of her profession. Mary grew up in Elmwood and returned after her pharmacy studies, driven by a desire to give back to the community that raised her. Her approach to healthcare is holistic. She believes in treating the person, not just the disease. This philosophy has made her a beloved figure in town, someone who people trust not just with their prescriptions, but with their fears and hopes. As the sun sets, casting long shadows over the quiet streets of Elmwood, the glowing lights of the pharmacy promise more than medical remedies. They offer a sanctuary where compassion and care are just as crucial as any drug. Mary's Pharmacy is not just a place to pick up medicine. It's a place where healing begins with understanding and kindness. It was a chilly Wednesday morning when old Mrs. Thompson, a regular at the pharmacy, came in, looking more troubled than usual.
She confessed to Mary that she couldn't afford her diabetes medication after her husband's recent layoff.
The distress in her voice was palpable, and she looked on the verge of tears, helpless and afraid.
Let's see what we can do.
Without hesitation, Mary reassured her with a gentle touch on the shoulder. She spent the next hour on the phone, contacting various suppliers and charitable organizations, seeking a way to get Mrs. Thompson her medication at a cost she could afford. It was not the first time Mary had done this, but each instance was handled with the same urgency and care as if it were. By the time Mrs. Thompson left, the relief on her face was clear. She had her medication, and more importantly, she carried with her the comfort of knowing someone was there for her. This wasn't just a transaction of goods. It was an exchange of humanity, a moment where Mary's role as a pharmacist blurred into that of a guardian and friend. The story of Mrs. Thompson spread quickly throughout Elmwood. It wasn't just about the financial assistance Mary had provided. It was about her genuine concern and effort to help a fellow resident in distress. This act of kindness resonated deeply with the community, highlighting how integral Mary had become, not just as a healthcare provider, but as a pillar of support. Encouraged by the response, Mary started a pay-it-forward jar at the pharmacy. Customers could contribute spare change, and the funds collected would help cover the costs of medications for those who couldn't afford them. It was a simple idea, but it fostered a sense of community and shared responsibility among the residents of Elmwood. The impact was immediate and significant. People started coming in not only to contribute, but also to express their gratitude. Some shared their stories. Others simply wanted to say thanks. The jar was more than a collection of coins. It was a testament to the collective spirit of Elmwood, inspired by one woman's act of kindness. Building on the success of the Pay It Forward jar, Mary launched a broader initiative called the Elmwood Community Health Project. The project aimed to address various health issues in the community through education, free screening days, and support groups. It was a holistic approach to health that went beyond dispensing medication. Partnering with local doctors, nutritionists, and other health professionals, Mary organized monthly health seminars. Topics ranged from managing chronic diseases to nutrition tips for seniors. These sessions were well attended, reflecting the community's growing interest in health matters and their trust in the initiatives Mary proposed. The Community Health Project became a model for other towns, showing how healthcare professionals could play a transformative role in their communities. Mary's vision and efforts were instrumental in not just treating illnesses, but in preventing them, educating the community, and building a healthier society. Mary's initiatives sparked a ripple effect throughout Elmwood. Other businesses started to adopt similar community support models, from the local grocery store starting a food donation bin to the bookstore setting up a free book exchange. The town was transforming, with each act of kindness and community support feeding into another, creating a robust network of care and assistance. The effects were also felt in individual lives. People like Mrs. Thompson, once burdened by the cost of healthcare, now participated actively in community health events and even volunteered to help others. This empowerment was a direct result of the support network that Mary had initiated, demonstrating the profound impact one individual could have on the lives of many. Elmwood's story became one of inspiration, showing how compassion and innovative thinking in healthcare could lead to a stronger, healthier community. Mary's belief in the power of community care had not only changed lives, but it also set a standard for what it means to be a healthcare provider in a small town. Mary Bennett, with her dedication and empathy, has shown that the role of a pharmacist, or any healthcare provider, can be so much more than the sum of its parts. In Elmwood, she is more than just a pharmacist. She is a caregiver, an innovator, and a community leader. Her story is a powerful reminder of the impact that one dedicated individual can have in transforming lives and strengthening communities. As Elmwood continues to thrive, Mary remains at the heart of its evolution, driven by a belief in the power of compassionate care. Her journey is a testament to the fact that when healthcare professionals go beyond their call of duty, they can create waves of positive change that resonate well beyond the walls of their practices. Mary's story is not just about healthcare. It's about the human connections that sustain and uplift us all. It's a narrative that underscores the profound impact compassion can have in any profession, reminding us that sometimes the best medicine is a dose of empathy and understanding.